Hello there, and welcome to the first in the series of NHS Joy webinars that we'll be running. My name's Danny Ryan.
Hi there, I'm Anna Howells.
And we're from Kaleidoscope, a social enterprise set up to improve health and care in the United Kingdom. And the way that we do that is through collaboration and through facilitating difficult conversations. But today we're going to talk about, is joy in the workplace possible in 2018? So, we see all the headlines all the time. The NHS is in crisis, there's waiting times in A&E, operations are getting cancelled. So should we even be talking about joy at this time? Well, we think we should. We talk about low morale. Let's not bring negativity into the conversation. It's all about positive deviance. What can we do well? Let's start with, well, what is joy? Joy is enjoying your job. It's having good relationships with your colleagues, with your patients, with anybody you come across at work. And it's, realizing the value and the benefit of what you do for your patients. We've got a bit of a focus on primary care. Of course, everything that we're talking about applies across the NHS really today. We want to talk about the value of joy, the benefits, improvements in patient safety, improvements in patient outcomes, and all those real practical things that you can do to bring that joy into your workplace. Now, we're very fortunate today to have with us Professor Helen Stokes-Lampard, Chair of the Royal College of GPs, and Bob Claver, who's one of the paediatricians from Imperial College, who are going to be giving us some of their practical tips and advice about joy in the workplace and the lessons that they've learned about bringing joy into the workplace. So, without further ado, we're going to start with Bob, if that's all right. If you want to tell us a bit about, what you've learned, and I think a good starting point is as we're thinking about these things, thinking about the questions going through, is what makes for a good day at work? What makes for a joyful day at work? But first of all, over to you, Bob.
Okay, thank you very much. I hope good afternoon, everybody. I hope the sound is good and nice and clear. So I'm a paediatrician. I'm a general paediatrician who works out in northwest London, and I guess you might be saying, what on earth am I doing on a call around a joy with a particular primary care focus? Well, I guess it's a bit about turning that on its head. One of the key areas where I get a great sense of satisfaction and fun and learning in my work has been through the interaction with colleagues in primary care, and particularly GPs, around child health. So we've got a really wonderful programme, a collaborative called Connecting Care for Children in northwest London, that really is, in a sense, all about bringing people together to talk about cases, to talk about children and their families, and to try and do our best together to provide fantastic care. And in doing so, building up some real sort of sense of purpose about what our work is all about. So in answering the question around joy, I think just to flag, there's an interesting bit about the word itself. I've been relatively involved with some of the work in North America where joy in work and the IHI, a lot of energy around it. And I think it's an interesting word in itself, and I think even the Helens and me's of this world who are hugely passionate about the sort of and optimistic about so much that goes on, in some ways it's quite a hard word to sell. So I'm going to try and give you a bit of granularity about what I think it's all about. Three things for me. Number one is about relationships. I think healthcare is a human people job and task and opportunity, and that's where we get our energy. It's where we make the most difference to patients, to families, to our communities, to citizens who we come into contact with. And so really trying to get the very best out of those relational conversations is absolutely key. And so some of the behaviours and actions around that are really important things, like listening, the really simple acts of kindness, that time spent with people, just sort of being there, the presence. I think there's interesting stuff about mobile phones and how, amazing technology, and we wouldn't be able to do this without that. But actually, how do you make sure that when you're in the moment with a member of a colleague or a patient or a family, how are you really present? How are you really, really listening? There's a wonderful Michael West, he's well worth looking up, professor of sort of leadership, a great expertise in teamwork, work at Lancaster and the King's Fund. He talks about listening with fascination. So there's something about those sorts of behaviours that I think really provide a depth of relationship that is so key to our job satisfaction and making work great. The second bit is about learning. So again, I'd say healthcare is a human enterprise, something about people and relationships. It's also about learning. And we do slightly bizarre things about this. We sort of, if you take the sort of medical profession, we frame it around training, and we sort of train people up, and they train, and there's all of this, and they're junior doctors, and emphasis on the word junior, and then suddenly this sort of overnight phenomenon, or maybe over a weekend, they become this sort of, Uber GP or Uber consultant. And it's sort of nonsense the way it's framed out. Again, all of us who work in healthcare, it's an ongoing sort of exploration of learning, of discovery. And I think a key to being sort of happy in work, having a real sense of joy, is that you're continuously learning. And in my opinion, the best way of doing that is together. And the success of our child health hubs that we've had in Northwest London are all about bringing people together to talk about patients and to learn together. And that's a really fantastic place and space, and undoubtedly where I get a huge amount of my satisfaction and my energy for work. And the final bit is a really quick story about feedback. So I think first one, relationship, second one, learning, and third one is feedback. And I'm particularly interested in the concept of sort of unsolicited feedback. And there's some guys who sort of talk about, the sort of random acts of kindness world. But the unsolicited feedback, the handwritten note that you might leave on somebody's desk, the sort of poking your head around the door rather than sending an email, becomes really key. And I was an old school friend of mine got in touch with me. This is a story from a couple of years ago, and just sent me a little email. And I hadn't heard. She's somebody who I'd sort of catch up with once a year. Hadn't heard from her for a while. She's nothing to do with medicine, and she had bumped into a mum at the school gate whose daughter had been having some really significant healthcare issues, and they got chatting at the school gate and having a lovely sort of empathetic conversation. And it turned out that the patient, the girl who had lots of healthcare issues, had her diagnosis, which is a really terrible diagnosis, explained to the family by me. And the feedback loop got back to me about how it was an incredibly difficult conversation, but a conversation that was done with a kindness and in a way that one would hope one did it. And that feedback loop that I wasn't expecting, when I had that conversation with that family, I had no idea that this school gate conversation would happen 2 years later. But my friend Lucy, who made the effort to email me back, say, I just thought you'd like to know that there at the school gate down in South London, this conversation was happening, and how that conversation you had made a real difference. Now, it's that sort of thing to me that makes a huge, huge difference. And we probably all generate these sorts of things every day. We're just very poor at closing the loop on them. So go and leave somebody a little note to say thank you. Go and poke your head around the door just to say, and be specific with people about something they did, about how that made a real difference. So that would be my final tip. So focus on relationships. Think about learning as a real route into joy. And in terms of a behaviour and an act, go and deliver and some unsolicited feedback. And you can I've even used the sort of trick of, you can send somebody a note or title it unsolicited feedback. It gives you a permission. People think, hang on, how could I give you feedback? Well, just use that as a way of doing it. And you get some quite unexpected reactions. So that's probably enough from me, and I'll pass the baton on to Helen.
Thank you very much, Bob. That's brilliant. I think, obviously the strong human element running through all of those. And sometimes, with all this technology around, it often gets lost. We talk about training, as you said, with junior doctors. Actually, that sounds like something boring and monotonous, and we need an online portfolio for this and for that. But actually, what happens to that learning? What happens to that deep learning? The communication skills you work on all the way through medical school, you're filmed, eye contact, all of that kind of disappears after you go into postgraduate training. And it's trying to capture those things again that we can try and do to bring that joy back in, the feedback, the relationships, building that relationship with your trainer, for want of a better word. I think you're absolutely right. So now we're going to go on to Helen. Are you still with us?
I certainly am. Yes. Hi there. Hi.
Fantastic.
Everyone. It's always hard following on after somebody like Bob, because he's so wonderfully enthusiastic and you've articulated it so beautifully. But I'd just like to say, everybody, my name is Helen Stokes-Lampard. I'm a GP, and I'm a happy GP. I'm a joyful one, and it's terribly, terribly unfashionable to admit to being happy in this day and age, to admit to loving your job. But it's true. So thank you, Kaleidoscope team, for setting up this great concept. I'm looking forward to seeing the outputs of it. So I'm a GP partner in a large surgery in Lichfield in Staffordshire. and I'm a professor of general practice in Birmingham Medical School, but I'm on the call because I'm chair of the Royal College of GPs, which is the kind of the overarching organisation for GPs throughout the UK, and indeed we've got thousands of members worldwide, and we're the largest of the medical royal colleges. And in my mantra, when I stood for election, one of the things I said is I want to do my bit to restore the joy to general practice, because we have so much to celebrate and so much to be happy about. Yes, there are grim bits and it's stressful, hard work, and yes, we're under-resourced, and yes, it's challenging and we're over-regulated, and it's scary, downright scary at times, the amount of uncertainty we handle. But we're paid well, we're respected, we're trusted, we've got remarkable levels of autonomy, and we meet remarkable people every single day. In fact, we meet remarkable people every 10 minutes, every single day. And so rather than kind of be as logical about it as Bob was, I'm just going to share a few little gems with you, but perhaps those will provoke some discussion. I'm very struck by Sarah Wollaston, who is the MP, and she's chair of the Health Select Committee. But she was a GP, now she doesn't practice anymore. And she said that when you switch from having the title GP to MP, you suddenly realise how loved we are as healthcare professionals. And I take that, and when I'm having a bad day, it's one of those, yes, but just think what a hard time so many other professionals have compared to us. I've got personal policy in my practice, and my policy is I only have lovely patients. Of course, some of them do their best to appear unlovely, but underneath it all, everybody is lovely. And it's one of those really helpful mantras for dealing with difficult people, and it's one of my survival strategies. Picking up on something Bob said, I genuinely believe that feedback is a gift, and gifts are important to give as well as receive. And when you get feedback personally, just as Bob did, you take it on board, you ruminate. Now, it's good to have the constructive feedback, doesn't always need to be good feedback, but giving people feedback that is meaningful and useful is important. So when we give feedback, we should do it with good grace, and we give it away. So once we've given it away, it's gone. And when we receive it, it's receiving it as if we're receiving a gift. And I found that an incredibly helpful way for dealing with some difficult feedback as well as dealing with the lovely stuff. And it's very easy when we get the lovely stuff not to think about it and reflect on it and just to say, oh, that's nice, and put it at one side, because that's the nature of the sort of professionals most of us are. But it's really important to think about the good as well as the bad stuff we get. Taking time to understand yourself as well as understanding others. Now, GPs tend to think they've got the monopoly on consultation skills, which, as Bob has beautifully illustrated, is clearly not the case. But actually, when we, to be really great at communication skills, learning about ourselves and how we communicate, our personality types, the basic psychology can really help. When you understand yourself better and understand a bit about personality types, you understand others better. And I found that just understanding about personal energy, about introversion and extroversion, and how to communicate better with people has been incredibly helpful and made my consultations a lot more joyful. Another one for me is when you get the bad stuff is about being able to handle it, sort of putting it in a box and moving on. So when you get something really difficult or really challenging, it's how you handle it. And when you've ruminated and thought about it and reflected on it, you've done with it. And put it in a box and move on and leave it behind. And I'm happy to pick up on that again later. And finally, I want to share with you a pseudo-statistical concept that I have created. It's one of the nice things about being a professor. You're allowed to do things like make up statistics. And it's called the numbers needed to undo harm. And it's the numbers of positive or joyful statements or actions that we need to do to undo the harm to our own profession, of negativity or aggressive bad-mouthing about ourselves. And I've done a little bit of research about this, and as I say, it started as a bit of a joke, as a kind of, is it one or two good things that somebody has to say to undo the harm of one bad thing? It's far worse than that. Turns out Lufthansa and the airlines do a huge amount of work on this sort of thing. And if a person on an airline has a bad experience, that will adversely impact on 14 other people. So that you have to undo 14 things. So 14 good things have to happen to undo one bad, as far as Lufthansa are concerned. I started out thinking it was a handful. I'm now reluctantly accepting that it is way up in the teens in terms of how many good, positive and joyful things that we all need to do to undo the negativity that some of our colleagues are spreading. So bring on the joy, bring it in. You can't have too much joy and happiness. Of course, we've got to be realistic. But let's be of this world and celebrate what we've got, because actually we are very blessed indeed. So I'll stop there and hand back to the guys.
Absolutely, and thank you very much, Helen, for that as well. I think pick up on some things that you said there. The grass is always green on the other side. That's how we are as doctors. And that quote from Sarah Wollaston saying, going from GP to MP, you realise how lovely we are. I think you're absolutely right. And sometimes it's quite easy to forget that across the board with health professionals. We're going to go to questions now. While Anna's collating them and getting them all ready, I'm actually going to take the chairman's priority, I'm afraid, with the first question and pick up on something else you said, Helen, if that's all right. So taking time to know yourselves was the question, was the point that you raised there. And so my question to you first, and we'll let have a few thoughts from Bob too, is whose responsibility is it to maintain joy in the workplace? If you don't know yourself, can you make that joy yourself, or is it the employer's responsibility?
Well, that's really good. I mean, we're all in it together, aren't we? I mean, there are certain things that employers can change, and there are certain things that employees can change. And employers are not crystal ball gazers. They're not telepathic. They don't know if people are unhappy unless it's communicated to them. So I think there's it's because it's always easy to blame the boss and blame the system when there are things that we can control ourselves. We can control whether we walk into work feeling in a stinking mood or feeling in a good mood, actually. We can control whether we choose to read websites that are full of negativity, aggression and misery, or we can choose to surround ourselves with people who have a more positive view of the world. However, the system is in a very difficult place. There's no question about that. We're unquestionably underfunded, under-resourced, and we are working in ways that are feeling increasingly unsafe. So it's national, it's local, and it's personal, would be my view. Interesting what others think.
Yeah, Bob.
Yeah, well, it's lovely to pick things up. I very much agree with Helen. I think part of the narrative, though, is it has a bit of a learned helplessness around it. And so I think Helen's given us absolutely bang on the right frame to think of it. But I think the leadership bit for all of us, and that's whether you're a medical student or, you're a chief executive or everybody in between, is that you absolutely have you have some influence around you. So one of the things I'm really tough on, go back to the medical students, they often introduce themselves as, I'm just the medical student. So I have a sort of slight antibodies to the word just, especially when my middle daughter uses it after 9 p.m. When I'm trying to get her to bed. There's something about people trying to sort of play themselves down, and what I talked about the human bit, everybody, how that medical student or a junior administrator or a volunteer working in a GP practice can influence people around them by the way they stand, by the way they smile, by the way they hold a door open for people, by the way they get chatting and asking people a little bit about them and their lives. It really, really has influence. And I've been doing a bit of an experiment over the last few years around one of the key sort of currencies for me as a consultant is our attending week. We're on call for 7 days and I'm lucky I have a particular children's ward where I'm responsible. And to me, the leadership ask of that is not to do lots of clever bits of paediatric medicine, which is a good job because I'd fall very well short, but I have lots of great people around me and fabulous junior doctors and amazing nurses and therapists. My role is to create and enable an environment where people feel energized, where people can absolutely perform to their best. And I work with amazing people. And my role as the leadership role is to, in my mind, is absolutely to create a culture that is calm in and amongst all of the massively busy things and the bed pressures. And I'm really convinced, I've been sort of experimenting on this, that you can actively do that stuff more and more and more. So some people love to say it's always busy when I'm on call. I love to talk about actually it's always pretty calm when I'm on call. And if you look at the data and the stats over a 3-year period, consultant on calls are going to average out as being the same. Your approach to it can instill some calm and some sense of order and some sense of people being in control, which in itself, if you're in control of things, I think leads to a huge amount of job satisfaction. So as soon as we get into reactive, chasing our tail mode, we feel stressed, we feel stretched, and we feel out of control. And I think some of that you can create. Not all of it, as Helen's rightly said, but we perhaps underplay our influence at being able to control and indeed to influence up. So you can absolutely, somebody, I think junior doctors are amazing at this. They're really amazing people who come in to a GP surgery or onto a ward round and just have that spark, have that energy, that creates a real sense of great atmosphere around. Or a ward clerk would be a great example in a ward setting. A GP receptionist who does that, I have absolutely no doubt, would have the same sort of influence. So I think recognizing we all have influence, and actually perhaps more than we think, is really key to this.
And actually linking quite nicely to that now, I can see a question there linking to the training. Anna, can you?
Yeah, so we have a question touching on Bob's point. So to what extent are we training clinicians to do a job that they will enjoy?
Yeah, so how's what you're saying there about the empowerment translating into how you train those junior doctors to go forward and do that?
Do you want me to kick off and then pass? I would say very poorly in terms of how curricula are designed. I think trainees hopefully get some exposure to it. As an example, we have medical students from Imperial College who come through, and I'm responsible for a little cohort of them each time they come through paediatrics. So I sat down, and one of them was very upset first thing in the morning, sitting there with a group of 4 people, and she said, my flatmate is a mechanical engineer, and he was telling me last night that I don't know why I'm training in medicine, because there aren't going to be any jobs. It's all going to be taken over by computers with artificial intelligence. And she said, I'm so cross with myself because I wasn't very eloquent at giving an answer back. So we were meant to be learning about bronchiolitis or whatever we were meant to be learning about. So we decided not to. And we had a fantastic hour really exploring, well, what is it about being a doctor, and why does that argument not add up in the way that it does? And I'm sure computers and artificial intelligence, which is a topic for another webinar, will do all sorts of things, but they absolutely won't play in the space around empathy, around kindness, around the sorts of things that we've been talking about. And I think we've got to expose medical students, and as you alluded to as well, I think medical students probably get a little bit of it. Postgraduate training is generally quite shy of really exploring. I think general practice probably does it better. Hospital-based training, it'd be near nothing. I think us paediatrics, we maybe sneak in a bit, but I think we could do a whole load more. What is it really about to be a doctor, or indeed other healthcare professionals? And the behavioural side of things becomes very important, and we don't pay it enough attention.
Yeah, and I think that was the point about AI, is it can't care, not like humans can. And in our Writing the Future competition we ran, a lot of the short stories had a theme running through them, that yeah, you could get this really accurate healthcare from robots in the future, but actually, the premium stuff is when you go to a human and you can look someone in the eye and feel that empathy. But Helen, Bob says you can do it better in GP. Tell us about it.
Well, general practice training does have a very good reputation in terms of the quality of the experience we give both undergraduates and postgraduates, because it's very much one-to-one teaching. It's based on I guess an apprentice model. We still have the 1 or 2 trainees with a trainer approach, which is a lot more personal. But because more of our interactions are behind a closed door with the patient, that's kind of an inevitable part of how we have to train, and that's a huge opportunity. But it's a huge opportunity for getting it right and getting it wrong. And our colleague did a report recently about the impact of the influence that students, undergraduate students are seeing by their training, and who's having the greatest positive and negative impact on them. And of course, the most powerful experiences are the ones they're having with clinicians. And a good experience with a clinician has a really positive experience, and a bad one turns you off. It shouldn't be a surprise to anybody, but I have come up with a mantra which I've been derided for. But actually, if you're having a good day, tell a trainee or a junior colleague, and if you're having a bad day, seek help from a contemporary or somebody who's in a position to help you with it. I think when people vent and rant to trainees and juniors, it just gives a distorted view, and it's back to my numbers needed to undo harm concept. And that's not about hiding the truth from people. That's about sharing the good stuff, because it's easy to share the bad, but we forget to share the good, which is a kind of theme which is coming out here today. I think the other thing about training for happiness is just as a concept, so much of what we do is this whole thing of osmosis. There's the what's it called, the hidden curriculum as well as the planned curriculum. And in undergraduate circles, we talk quite openly about the hidden curriculum, all the things, the values that students absorb, the professionalism and so on, that isn't taught overtly, but it's what is mirrored in what they see in others. And I think we do forget that each and every one of us is a role model for somebody. And I think I love the just a medical student notion. You know, you think about other students and you think about sixth formers who look up to medical students as this phenomenal sort of success, vision of success, and then you get into the system and you feel like you're just a junior doctor, or you're just a GP is one of the things we fight against. And the number of times I remind people that GPs are consultants, and consultant colleagues with CCT, and don't ever give me that nonsense about consultants, and don't ever be just a GP. I mean, can you imagine if a cardiothoracic surgeon said, "Oh, I'm just a cardiothoracic surgeon, I'm just a partialist." You know, it's a turn these things around, hold a mirror up to them, and you know, let's have a laugh about them, but actually call it out when we see this negativity and this downplaying and this denigration of ourselves. You know, we're amazing. Let's celebrate that.
Yeah, absolutely. And that's what we're trying to do today, is change that negative conversation and this kind of positive deviance that you're both demonstrating and telling us about today. And we've got a little swear jar for anyone who's negative, actually. So if you're being negative, we're going to expect some donations later on. But Anna, what have we got coming through on the chat now?
Yeah, so we have a comment from Jane. Thank you, Jane. And it's just going back to Helen's earlier points about how we handle the bad things. And Jane says that she agrees with what is being said and would add that we also need self-care. So that's our own physical health and well-being is part of the equation to feel joy at work. And just whether either of you had any kind of further comments on that area of things.
Shall I jump in on that one then?
Please do. Yeah.
You know, one of our favourite mantras is, you know, put your own oxygen mask on first. You can't care for others if you're not caring for yourself. First of all, if you're not fit, you're not well, you're not healthy, you're not in a pretty good place, then you're not in the right place to be caring for others. So. And then once you've cared for yourself, it's looking after your colleagues, because we are all in a team sport. Medicine is very much a team sport, and if you're spotting signs of concern in your colleagues, it's having the courage and I guess having the skills to approach that sensitively in a supportive way. And then we can be good, compassionate, caring individuals who can do our bit for society and mankind. And I think recognising that all of us will get ill at some point, whether that's a physical illness, whether it's a mental illness, we will all be broken at some point. And I think realising that we are human and need healing ourselves, it's really hard as a healthcare professional, because generally most of us who embark on a medical career are fit and well, we're bright, we're lively, and then sick doctors, becoming a sick doctor is a hugely challenging thing. I mean, you know, I've seen a lot of it as a GP. I happen to work in an area where we've got a lot of doctors as patients. So I've got a reasonable amount of experience in this. But I think particularly secondary care doctors feel even more isolated, because a lot of GPs by definition will have doctors on their books. Perhaps we see it a bit more, but I think secondary care colleagues may not realise just how much sickness there is out there. So there's something there about giving people permission and not letting people try and struggle on their own, particularly I think with mental health disorder or addiction problems. Even the stress side of it, you know, recognizing it does grind people down at points. You know, I talk all the time about the triad, the social, physical and psychological elements of people's lives being the essence of what we do in general practice. It always amuses me when people outside medicine think all we do is the physical. That may be true of some specialities, but it's certainly not true of general practice, general medicine, paediatrics. You know, it's that spectrum of care, because we're dealing with human beings. We're not dealing with cats and dogs.
I totally agree with Helen there. A couple of things just to quickly add. I just want to pick up the GP consultant bit, because I think it's so important, and it's a drum I've sort of beaten for a while. We're particularly poor across sort of traditional professional or organisational boundaries, whether it's a provider organisation and a regulator, whether it's a doctor or a nurse, doctor manager. GP consultant would be an absolute cracker. The sort of behaviours and interactions that can happen in that setting can be really, really poor, and they can have a very, very wide impact and on the people involved, and indeed on patient care. So I think people paying particular attention to I think I love Helen's 14-to-1, and I've sort of been playing around it with my mind. My hunch is that you can get an even better sort of bang for your buck on some of those sort of cross-organisational, across traditional boundaries, where it's just sort of almost become a fashion or a mantra to be unhelpful across those boundaries. And I think being sort of really counterculture to that has extra power. And the other bit is the people bit, a project that I've not yet done at Imperial. We've got something like 11 and a bit thousand people who work here. And I use the word people very deliberately. When you get chatting to people, they all have amazing things going on in their lives. Carers, they have got an intention to climb Kilimanjaro, they've rowed across the Atlantic, they used to be in the National Youth Orchestra, etc., etc. And I think I would love to do a piece of work that explored who are these wonderful 11,000 people, what do they do? And I suspect we're all sat working, we're you know, in a GP practice or you know, on a ward or in an office with people who we've sat with for weeks and months and years, and we've never stopped to find out, you know, tell us about your weekend, what have you got planned, or, you know, what are you thinking about for the summer, or what are the things that really matter to you? So the what matters to you story that I think is incredibly powerful, and many people on the call will know about it, in terms of, rather than asking patients what's the matter, you're really trying to focus on the things that matter. I think there's a lovely lens on that around staff. What are the things that really matter to people we work with? And actually asking that question gets you into a really interesting space, and much more of a people space that allows you to be diagnostic. Bit like Helen's lovely piece earlier about, I get very upset when staff talk about difficult parents we get on paediatric wards. And, you know, I'd be a really difficult parent if one of my children was unwell, because I'd be really stressed and anxious. And I love Helen's way of reframing that. The other piece to that is being diagnostic. So where we get a behavior that is difficult or negative, or rather than just sort of rising the negative tension, we're all incredibly experienced, trained diagnosticians trying to understand what is the perspective, why is that person being difficult or being a bit angry or being a bit aggressive. If we can get to the cause of it, you almost certainly can unpick it. So there's something about using our skills perhaps a little more thoughtfully than we sometimes do when we just sort of rise the tension.
Yeah, and one of the things, you know, we're saying is, one of the responses was, well, you need time. There's not enough time in the NHS at the moment to do these things. So, you know, one of the questions that's come up on the chat from John is, how do you stop these kind of cynical responses? If someone says, well, okay, yeah, they're a bit stressed and things, but their child needs treatment, so you just got to get on and do it. You know, how do you counter that?
Who wants to take
nice, easy question. Who wants to go first?
Yeah.
Go on, Helen, you go.
Yeah, there's for counteracting negativity, you say. I mean, I said there's that whole thing I carry as Bob's alluded to about everyone's lovely underneath it all. Some people hide their loveliness better than others. And that has actually served me incredibly well, because you know, everyone has their heart sync pain. You know, if you refuse to have heart syncs, it kind of sets the tone. I mean, I think we've all got different strategies for dealing with aggression and negativity, and certainly the diagnostician one is a really good model to see what's going on here. I mean, there are balanced group approaches to think about what else is going on here. The problem is that so frequently we don't have the time to deeply reflect about these difficult encounters in the moment. So in the moment, we often have to survive, and that's what we call on our experience, our sensitivity, our emotional intelligence to handle it. But if you have got the headspace to log it and talk it through with a colleague afterwards, I mean, you may not have the luxury of the time to do it as a balanced style. And if you don't know what I'm talking about, look up balance groups. It's a really interesting way of dealing with this stuff. Mm-hmm. But actually, turning it around and putting yourself in the patient's shoes and what was going on there, it's really powerful, really helpful sometimes. And amazing things can come out of it. You know, back to the whole consultation skills, what's going on, what's the patient's agenda, what's really behind all this, what's the hidden agenda, what's the problem that I'm missing. And then frequently you see, what am I missing here, is my other way of thinking about it is really helpful. And that's not highly scientific, it's just, you know, what I do. And I think bearing in mind in the moment, you've got a short, in our case, 10-minute consultation to deal with all of this stuff. But in general practice, what you can do is buy time and bring a patient back. And time is very powerful too. And I think sometimes we get guilty about bringing people back, but actually it's a very, very powerful way of dealing with and diffusing difficult situations. Bob?
And that applies beautifully to colleagues as well. The idea that you can have a conversation around this sort of complexity and importance in one little snapshot or by email, which would be the classic way we try and deal with these things, is real nonsense. So one has to, I think that ongoing narrative becomes really, really key. The only other thing just to flag, and I wrote it down earlier, was with reference to the stuff around feedback. Quite an influential book. I wish I read more. There's a million things I wish I did more of. But one of the books that was quite influential for me is a book called Thank You for the Feedback, and it's a East Coast of American book that's come out of Harvard. But it's this lovely premise that you can learn to receive feedback in a more sort of thoughtful and intelligent way. I'm quite into sort of how do you reframe things and turn things on their head, and this idea we get growing amounts of teaching around how to give feedback, and I totally agree with Helena's sort of frame about it being a gift, but something about how do you receive feedback and how do you actively go and find feedback in a way that's helpful. Thank you for the feedback. I'm not on commission, but it was a very good read and a relatively easy read.
Okay, and can I just add one tiny thing there, that feedback is a gift, but like as with all gifts, and I'm sure this will be resonate particularly at this time of year when we'll be looking at Christmas gifts, some that we wanted and some that we didn't. You don't have to love every gift. You just receive it graciously, receive it well, think about what you're going to do with it. But some gifts are best passed on, or so I'd like to give to the charity shop.
Absolutely, and we've got a lot coming through on the chat now, so should we go to one of those? Anna, what have you got for us?
Sure. So thank you, Yvonne, for your question. And Yvonne says, so my work is about recognising and supporting staff with their emotional labour, and that caring is hard work and can be energising but also draining if people aren't supported. So have either of you got any specific strategies that you've perhaps used yourselves or amongst your teams for supporting others with this?
Shall I kick off? So I think there's some things that are structured and some things that are unstructured. So we, as a trust, have really started to thoughtfully use Schwartz rounds in a really fabulous way, actually, and massive credit to the guys here who've done that, and our sort of hospital-based charity has supported them. At a team basis, the real concept of debrief, and we've done a fair bit to train up people to be good at debrief, and there's a real sort of skill around that. So particularly around a significant event happening, and whether that might be a sort of system event, a major incident. We had, Grenfell very much on our doorstep here in northwest London would be a big example, or a critical incident, or in my case, a child dying in the ED department, that sort of thing. But actually, perhaps sort of soft, not quite such sort of significant events. Debrief is a really sort of key method as well. The final bit to say on the sort of informal bit is back to my friend Michael West and listening with fascination. Again, challenge to everybody. And I love talking about this because I'm not as good as it as I would like to be. And in talking about it, I'm going to go and be better at it next week than I was last week. Is when we go and talk to people and we're having a conversation and they're struggling, and this was the premise of the conversation, go and properly listen to people. Don't be distracted. Get properly in the moment. Do things that you can do to really properly give people time. One of my vices is sending emails at 1 o'clock in the morning. Part of the reason for that is because I just not around in the day doing emails. Absolutely go out and spend time with people and go and listen. Go and be present. Go and sit on wards. Go and talk to colleagues in receptions. Go and spend time with people in the labs, wherever they are. Properly go and be with people and listen would be my key bit on that.
Okay, shall I just jump in on that one then?
Yeah,
I'm absolutely delighted to hear about the Schwartz rounds in your hospital. So the GP equivalent of strategies for dealing with the emotional turmoil that we deal with. And in our practice, the rule we have is that GP coffee meeting is not optional. We get together every day. And it's really easy to kind of find an excuse not to go along to these things because you're surrounded with paperwork and there's too much to do. But actually, an expectation that it's just as important to speak to your colleagues and debrief or share difficult stuff as it is to see the patients in the appointment time. So that's one thing that works in some places. Other practices have huddles, which I guess I move on to the smaller scale version of the Schwartz round, getting everybody together to talk about cases, which can help share things. Just the whole concept of debrief is understanding what you need as a person. And so this is back about knowing yourself, and whether you're a Myers-Briggs introvert or extrovert, what energizes you and what drains you. And what you may need actually is cave time and peace and quiet, and giving yourself the space for cave time and giving yourself permission. I'm married to an engineer. No, we won't go back to the adverse comments from engineers earlier. Who's a profound introvert, and recognizing that when he's stressed out, that actually he doesn't necessarily want or need to debrief. What he needs is to clear his head and go and kill some aliens by playing a computer game. It's very, very liberating in our relationship, as I need to talk about things, and I'm an extrovert, and I need human contact. But not everybody does. There's something about understanding yourself and those around you as to what you need as individuals. And I think there's this whole thing about making the system work to make it easy. So I said the GP coffee, you can only have GP coffee time if all the GPs have a gap in the day where they're not all seeing patients, somebody not seeing patients, and making that rules so that the system doesn't impede the good intent. I'll stop now.
One of the things that you said earlier, Helen, I just want to go back to it. You said you don't know if someone's happy unless it's communicated. So what are the ways that you employ to find out if they are happy at work, if they are joyful, or, because sometimes it can be quite easy just to, for them to go home and grumble, and it's not necessarily that productive. How do you encourage them?
Yeah, we're all very good at wearing the mask, aren't we, as professionals? I mean, we're trained to put the mask on, and whether it's the mask to not show our horror at something a patient's told us, or it's the mask to not get emotionally too involved in a very difficult situation. We need those masks to help us survive. But they also do make it more difficult for our colleagues to know what's really going on and how we're really feeling. So exactly as has already been said, I'm very taken by Bob's enthusiasm for getting out there, pressing the flesh, seeing people. So you've got to ask. You've got to genuinely ask people, but you have to do that in a trusted way. You can't just do this. So how is everyone feeling today? Kind of superficial stuff. That doesn't work. This is about genuinely asking, genuinely caring, and genuinely listening, and finding the right scale for doing that. I now work in a large GP surgery. We merged not so long ago, and that was an interesting experience in itself. And staying joyful through a merger is not easy. But actually making that effort. So you do need to make an effort to check if people are happy. And this is something that managers can do, but everybody can do. Each of us works with an immediate cluster of people. And if we just make it our business to find out if those immediately around us are happy or unhappy, and had a discussion with somebody else as to what we can do to make it better, just that act will improve the situation. And obviously, if we all repeated that, it would help. Sometimes just identifying a problem is halfway to solving it. Yeah.
And Bob, I can see you nodding away there. Is there anything that you'd like to add?
Well, I just want to really reiterate Helen's point around, a thread of the whole conversation has been about leadership, and people might, different people have different definitions. But to me, this whole call's been about leadership, and it's that leadership. My frame for leadership is how do you behave yourself, your interactions with teams, and how does that influence the system? And Helen's absolutely right. It's the bit about preference, and Helen gave the example of the extrovert and introvert, and that's incredibly powerful. And it's two ways. It's how do I behave? You've got two extroverts with a sort of in bold E on the line, and that's great and has some strength, but also can get in the way of some of these conversations. And so recognizing how my preference is and how that might impact on other people around me in these conversations is really important, and then recognizing how things may land. But the other bits of, we're using Myers-Briggs as one frame, the thinking, feeling bit of it is another hugely important one. Some people are much more analytical about their thinking, and other people will go very much for the feeling aspect of it. You can play that out where you've got two people with really quite different preferences, and that can mean sort of mistuning in of conversation. So part of when we're talking about really, really listening and doing that with depth is recognizing that different people have got different preferences around it. There is as valid as each other, and it might be a bit of an extrovert way of coping with my extroversion getting in the way, is outing that me being sort of noisy and wanting to put quarter-baked ideas out there, and just as Helen beautifully eloquently explained how she would want to talk to somebody in that setting, I feel exactly the same. Putting that stuff out there as not being the only version of the truth, but our preference, but then giving the space for other ones, I think is a really important one. Go back to the medical students, you know, the medical students and the nursing students and the junior doctors and the junior managers, they need to really have an understanding around it. And that bit of the hidden curriculum Helen was talking about earlier needs to be all over this sort of stuff, because I think you can't operate as a leader in healthcare, and we want everyone to behave as a leader, you know, and a follower at times, but you can't do that unless you understand this stuff. So I think it's very, very key underpinning theory, really.
Absolutely. So just a last question really for you both would be around, as these, I know there's a number of people in leadership roles on the call as well. And what are the kind of things that you do to keep yourself having joy at work? Without getting too personal, I don't know.
Do you want me to kick off? Okay. Things. Well, some of the pleasures and things. I think almost all of us paediatricians have one of these sort of crazy smashed up bits of a fluorescent kit. So lots of us here cycle. So a bicycle ride, sort of back home and to and from work, and we do a bit of multi-site stuff, and doing a lot of stuff out in general practice is a real pleasure. Part of it is the thought of me on the underground. It just, you know, doesn't go down well. So exercise and sport, and some of that myself, and some of that sort of with my kids is a big one for me. Definitely stuff with people, and that's people inside work and outside work, is a really key part of it. And just trying to get that sort of family mix. I'm always slightly loath to use the word balance, because I'm not convinced that it is particularly balanced, but it's having a really, really wonderful mix. And I feel massively privileged. I almost, you know, use the word greedy. I have so many interesting and exciting things going on in work and family and life, that I think that sort of keeps me going. Keeping a healthy mix is definitely key for me, the sort of variety bit, and trying to find synergy between things, and actually getting a great pleasure in seeing other people do amazing things. How can I be an enabler for other people? So a colleague set up an orchestra at Imperial, and she's really convinced that a conversation with me a year ago helped unlock that for her. I'm deeply unconvinced. I take zero credit, but she thinks that made a difference. Well, wonderful. If it did, it did. And I think it's those sorts of things that create a real sense of joy as well. Watching other people around me do amazing things is pretty fantastic.
Right, thank
Wow.
you.
I'd just like to start by saying I do not cycle. Okay, cycling plays absolutely no part in keeping myself joyful. So just let anybody be distracted by that. Now, actually, so for me, I'm going to go back to a point about 15 years ago where I had a life coaching session. It was a research project going on. Would GPs benefit from life coaching? And one task I did at the start of this life coaching, and the answer from the research was equivocal. It didn't prove anything, but I got lots out of it. It was marvellous fun. Was doing a life wheel, which is Google it, a really simple idea of take 8 elements that are important in your world, you know, your work. And for me, there were 3 elements of work, which is my clinical work, you know, my GP work, my university work, and my college work. That was 3 of my 8. And there was family, and there were friends, and there was spirituality, and all sorts of stuff. And it was, how do you rate each of those on a scale of 0 to 10? And you make almost like a spider's web look thing. And I realised that I wasn't prioritising having fun. But actually, I like having fun. And it was always the thing that I put last. I think it was my Protestant guilt, my Protestant work ethic thing. And I went home and said to my husband, darling, I think we should go to Alton Towers this weekend. He nearly fell off the sofa. But I suddenly realised I needed to give myself permission to have fun and to do frivolous things. So something about stopping feeling guilty for having fun is a really helpful thing to do. And as part of that, I realised how much I value fresh air. I garden, and I've always been keen on gardening. And I think, again, that whole Protestant work thing, because gardening is a way of being outdoors, but still working. But as a consequence, I've also I went and bought myself a convertible car, because if you've got to be in a car somewhere, at least have the top done and get some fresh air in the process. Or okay, somewhat argue about the carbon monoxide, but anyway, it's how I justified my convertible, and I stand by it. And I don't feel guilty about holidays. Holidays are really, really important times to recharge and to have fun and to actually share time with people who help you be you. I mean, I've mentioned my husband a couple of times. And I mean, I'm incredibly grateful to him for allowing me to do the crazy stuff that I do. I mean, I'm away from home, I travel a lot. And actually, he needs to know how much he's valued and appreciated as well. So something about sharing time with family and friends is really important, and valuing them and telling them how much they mean to you. Because I think most of us couldn't do it without those we care for. So there's a few things there. Yeah, but it comes back again to knowing myself and giving yourself permission. Don't feel guilty, being joyful.
Yeah, thank you both so much for your insights today. Before we close, I'm going to ask you to do one more thing, is just to think of a take-home message. I'm going to give you a few seconds to do that while we go to Anna, who's going to tell us what's happening next.
Yeah, and we'll also participate with the key reflections so we don't leave you on your own. But just to say that we have another NHS Joy webinar on Thursday the 11th, again at 4 to 5 p.m. But we're joined by Jessica Perlow from the Institute for Healthcare Improvement in the US to share some of their learning about their research into joy in the workplace. And this is all leading up, of course, to our all-day learning event on Monday the 15th of January at the Cinema Museum in London. And if anyone would like to join us for that, you can find more information about the tickets on our website, kaleidoscope.healthcare.
Yeah. So Thursday afternoon, we hope that we're going to see you again. And Monday, there are still a few tickets available for the event on Monday. So get on the website now if you want to come along, if we've piqued your interest. So we're going to go around now just with a take-home message each. Should we start with Anna to give our speakers a little bit more time?
We'll be kind. Sure. So I think my key takeaway, or what I'll continue thinking about, was just Bob's suggestion around thinking about how we receive feedback. And even though it might be challenging at the time, really kind of how you take it on board, even though it might not feel so great.
Okay. And Helen, what have you got for us?
I would say it's all about self. Understand yourself, look after yourself, and value yourself.
Thank you, Bob.
I'd say exactly the same thing. I think Helen's absolutely nailed it. So and Helen's lovely bit at the end about really have some fun, give oneself the permission to do that. It links to that bit about influence. If you're on top form and you're thinking about yourself, your influence goes up on the people around you, and so that leadership piece is key.
Yeah, and for me as well, I think that leadership point is the key one, of how much you can influence those people around you. But not only actually in a leadership position, but as a medical student, that simple things that you said, Bob, holding the door open, smiling at patients. And who's got that time to really sit down with patients, talk to them? It's people like medical students. They should never undervalue the contribution that you can make to joy to the people around you. So thank you everyone so much for joining us. To our speakers again, Bob and Helen, you've been absolutely fantastic, some great insights there. The webinar will be available online, but we look forward to seeing you on Thursday and hopefully on Monday as well. So from us, it's going to be good night and wishing you a joyful day.